Hi, my name's Anne-Marie Pryke, and I am your host for today's Second Act Living podcast. This is a place where people in the second act of their life can come together to talk, pray, admonish, laugh about everything that this stage of life has to throw at you. So please help me welcome today's guest, Travis Jeffords. Travis is a nurse practitioner who specializes in functional medicine. Born and raised in Jacksonville, Florida, married 17 years with 2 kids, 12 and 9. He has been in the healthcare industry for 18 years and board certified in family practice. 5 years ago, he decided to break away from traditional healthcare model and open his own clinic. So Hydro Med Spa has grown now with 2 locations and 3 providers. Congratulations. They focus on taking a functional medicine approach with all of their services. So thank you so much, Travis, for being willing to be on the show. I really appreciate it.
I appreciate you. Thank you. Thank you for inviting me.
So how we usually start is rapid fire questions. And since you're my first male guest on the show, which I'm excited about, I had to tweak the questions a little bit.
Okay.
So are you ready?
Let's go.
Okay. So when going on a date with your wife, do you choose a romantic candlelit dinner or Netflix and pizza?
Wow. Okay. I would say more the going out to dinner. Not necessarily a romantic candlelit dinner. I don't think we're quite that style, but definitely going out versus staying in.
Sure, because then you have to clean, you don't have to cook.
Yeah, I
all
mean,
the things.
we stay in, majority of the week, so we want to get out.
Mm-hmm.
Yeah.
So when going on a trip, are you the planner or the passenger prince?
Years past, I was the planner. Now I'm more the passenger prince.
Yes.
Now she sets it all up. She orders the flights. She gets everything squared away. She'll work with the travel planner if that's what we're doing, and and then I just ask.
So you just have to show up.
When and where, and what am I packing? So
that's good.
Yeah.
I am definitely the passenger princess for sure. What has been your favorite item you have bought for yourself in the last couple of years?
Oh, it's got to be the most recent one. So I just bought a new car. So
that's pretty nice.
It's pretty.
It's
nice.
a pretty sweet car.
Yeah, I just bought a new Z06. So that's
awesome.
You know,
and it's you wanted it for a long time, right?
It's been. I've been looking. I've liked Corvettes my entire life, and then the newer model, the newer, the C8, just looks so good.
They are pretty. They are pretty. So, what is your bucket list vacation?
Europe, actually.
Anywhere in Europe?
Yeah. Well, I mean, we've always talked about going back to follow our heritage. So, Ireland and Germany. I'm primarily German, and my wife Irish. So prior to kids, we never made it over there. We always wanted to. But finances aren't quite the same.
Yeah, they're not the same back then.
And now finances are better, but now we get the kids.
Yeah.
And so, but now they're getting old enough to where that conversation has kind of come back up again, and making the trip over there.
I recommend it. Italy is one of my favorite places of all time.
Oh, nice.
Oh my gosh, yeah. What is worse, waking up in the morning having no idea why your back hurts, or finding more ear and back hair?
Thankfully, I own a med spa, so
that's right.
The ear and back hair is not as big of a deal. Though it is awkward asking somebody to take care of that for you.
Sure.
Yeah, it's and now with hormones, less back hair,
or
more back hair, less back aches. Yeah, so yeah.
That's funny. What is your go-to stress reliever?
Oh, that's changed through the years.
Yeah. What about right now?
Yeah. I mean, right now is working out.
Okay.
Right now, making sure I go to the gym in the morning, those sorts of things, which have been lacking lately. But in years past, it was rode motorcycles, and so it was going for a ride. Was a good stress reliever. At one point, like going for a run. At this stage of my life, not running too much. So
there's nothing stress relieving about it.
Yeah, well, I think it was just more the burning of energy and the elevation of dopamine and everything like that. So
yeah. So what is one new skill or hobby you have always wanted to learn?
Playing an instrument.
Oh, cool. Do you have one in mind?
So I've gone through so many. My son plays piano, so I've thought about joining him on the piano, kind of the piano train. When I was younger, it was a trumpet. I wanted to play a trumpet.
Fun.
My uncle played the trumpet, so it was kind of, that. I've always thought it was cool to play guitar, right? So it's like the cool aspect
Yeah.
of that, being able to just, so some sort of musical instrument.
That's cool.
Yeah.
That's awesome. What is one habit or discipline that you have that has the biggest impact in feeling your best?
When I'm doing it, working out.
Yeah.
So being physically active, there is a direct relationship in how I feel on whether or not I'm consistent in my workouts.
Sure.
If I'm not, I could feel the drag.
Mm-hmm.
So now, the reality of it is sometimes you're like, I don't have time. I need to work. I get this still, but man, when you make that time, that 30 minutes, an hour, or whatever it is, it just opens. You get more accomplished. It seems. It's a lot.
100%. It feels like your day. If you can get that done, your whole day seems like, so much easier.
Exactly.
Yeah. So, lastly, what is one piece of advice you would give your 20-something self?
Ooh. That is tough. So my 20s, I spent 3 or 4 years there not doing much really in life. I was doing things, but I wasn't.
Sure.
I was advancing my career, but I was also, going out too much,
Sure.
things like that. And so sometimes I look back at that and I'm like, man, you could have been 4 years further along if you didn't do that.
Right.
So you should have maybe stayed a little bit more constructive back then. However, I learned a lot during those years, and it kind of shaped me on who I am.
Sure.
And allows me to do a lot of the things that I do because I have a solid understanding of that portion of my life. So it's weird. It's like I would want to be further ahead, want to be more disciplined, want to be a little bit more constructive, in my early 20s. But then again, I learned a lot.
Sure,
too.
and it probably forged you to be who you are right now.
Yeah.
Yeah.
So it's one of those things where you want to correct your mistakes and correct that portion of your life where you felt like you should have done something differently. However, those mistakes didn't knock me off my rails.
Right.
Like didn't completely derail me.
Sure.
In life in general, and I learned a lot from it too. So it's hard to kind of go back, but yeah, that's a tough one. That's
I get a gamut of answers for that one. Yeah.
Yeah, I don't know. Maybe just being a little bit more studious, and I took my time with college early on. I was always in college. I was always going. But I, one class here, 2 classes.
Sure.
I had a great job, so I was like, I'll finish this one day.
Yeah.
So
Yeah. So in our pre-interview, we talked about a lot of things, but I think why don't we start with why functional medicine? So how did you get into this functional medicine, hormone health area?
Okay. So I came from traditional medicine, came from that world. Even in that world, I always was trying to get to the underlying problem, and that's really what functional medicine is.
Sure.
Treating the underlying issues, not just saying, oh, you have high blood pressure, let me give you a medication. It was more of, well, you're also overweight and your diet sucks and you're smoking and you're doing all these other things, the things we talk about as being like, lifestyle factors, like
Sure.
things that are modifiable lifestyle factors. And in traditional medicine, you kind of just go, oh yeah, by the way, you need to eat better. Oh yeah, by the way, and it's not much of the conversation. It's kind of the afterthought. More, with functional medicine, that is the conversation. It's like, hey, let's talk all about these modifiable risk factors in your life. Let's talk about all these, vitamin deficiencies and things. In the meantime, we do need to lower your blood pressure. However, this is ultimately the fix.
Right.
And so there's a little bit of a different thought process there. And I always had that thought process. That was always the way. And so when I broke out on my own and opened up the clinic, we were trying to search for how do we want to label ourselves.
Okay.
And so we're not mainstream healthcare. We don't take insurance. We don't run that model. So, we were kind of going back and forth on what are we going to call ourselves. And, you talk about alternative medicine,
Yeah.
integrative medicine, holistic medicine. Like there's these terms that have been thrown away. And the problem with a lot of these terms is they come with a thought process in
A bias.
society. There's
100% a bias. Yeah, for sure.
Yeah. So, so people look at things a certain way.
Yeah.
And I don't want to put my name out there as being something I'm not. And so you have to be careful, even though the definition may mean something, what people think, it may be, something completely different.
Yeah.
So we, as we were kind of thinking through all of this, functional medicine fit the piece. And this was, 5+ years ago when I was making the decision. Now functional medicine's everywhere. Now everybody's talking about functional medicine. Where I felt like at the time it was kind of not a normal, like people would ask you, well, what is that?
Yeah.
What does that mean? Now people seek us out and they know. And so it's been pretty interesting. But that's kind of how we went that direction.
Yeah. So what do you think you talked about it a little bit, but what do you think are the biggest pros, cons for traditional versus functional model approach?
It's the mindset
Okay.
a lot of times,
Tell me more about that. What do you mean?
Like the mindset of how you plan on treating somebody.
Okay.
Right? And how you're going to go about treating somebody. The way people typically talk about it is like a Band-Aid approach compared to treating the underlying issue and really, making real change. That tends to be how most people describe it. As far as the differences.
Yeah.
The other side of that, a lot of times when you talk about the functional medicine piece, it's not, a lot of those practices are not covered by insurance. They go outside the traditional, insurance-based Medicare, Medicaid style models, and it tends to be more of a direct care model where it's a cash pay membership program, those sorts of things. The reality of it is a lot of times in the functional medicine space, there's more emphasis on communication and talking. There's more emphasis on getting to your personal underlying issues. So you're not coming in going, hey, I got a stuffy nose, whatever. Oh, I've got this cough, or that's typically not the conversation. It's more lifestyle things.
Sure.
Yes, you're working through lab work and you're utilizing a lot of traditional medicine, but the questions and the discussion tend to be a little bit more different. And it's like, we're going to have these short-term goals and then these long-term goals. And in order to get to these long-term goals, there's going to have to be big changes that ultimately in your lifestyle.
Yeah. No, so I can attest to all of your saying from a patient perspective. I kind of switched to functional medicine probably 4 years ago because I just wasn't getting answers. Right. And whatever, there's good doctors everywhere. There's not so good doctors anywhere. In both models, right? So learning
all of healthcare,
100%. So learning how to be an advocate for yourself, learning how to ask the right questions. But functional medicine for me, the first thing I noticed was it was amazing how much focus and time they gave me. I was the most important person in the room at that point, and they were listening to me. They were listening to what I was saying. They were listening to my symptoms and the history and all this kind of stuff. Anyway, I'm super pro functional medicine. And the other thing that I really appreciated specifically was it wasn't just a holistic approach. It was, okay, well, let's try medicine and this. Let's try, it was every tool in the toolbox was on the table. And that was new for me, right?
Yeah. That tends to be a lot of people in the functional medicine space on the provider aspect. It's like, well, let's talk about diet, let's talk about activity, let's talk about general lifestyle, let's talk about different supplements and deficiencies, which can be very powerful, and then, let's talk about lifestyle activities, all these things. And so it's, you tend to present the whole picture. And you're it's never just take this medicine, you'll be fine.
Yeah.
Or just take this, or I'll see you in 6 months. It's very rarely is it that. It's more like you're saying, here's everything that's going on.
Yeah.
Here's the big conversation.
And it's the peeling back the layers piece. Because I like that problem solving piece. So it was peeling back the layers of okay, this is your symptom, but what's the underlying, I never felt like the doctors had enough time to peel back layers, right?
We don't, not in that model, not in the insurance model. You know, in order to be successful, in order to pay the bills, you know, you've got, you know, a total of 15
Yeah.
minutes essentially,
Yeah.
sometimes less,
Sure.
especially in the primary care world. And it's just not enough time.
Yeah.
You have to be quick to the point, and there's no time to kind of really explore. Like, I don't have the time to ask you multiple open-ended questions. Like, it has to be a direct yes or no question,
Sure.
so that we can move
Yeah.
things along. Because even in that 15-minute space, I still have to document, I still have to do things, I still have to place orders or whatever it may be.
And then you have to switch gears to your next patient. Like,
correct.
yeah,
Mhm.
no, 100%. I mean, I was an occupational therapist for 20 years, and the primary reason why I decided to retire was insurance.
Huh.
I was like, I can't be the therapist that I want to be because there's not enough time. There, like, you know what I mean? Like, it was becoming really prohibitive. Like,
It's a big swing in the market right now. You're seeing more and more, especially in the primary care world, where people are going to a direct primary care. You know, even if they have insurance,
yeah,
they're willing to pay out of pocket, and they're willing to pay for the service because
Yeah.
they feel like they're getting better care.
Yeah.
So,
Yeah.
And it's not, you know, it's not a knock on
No, not at all.
those providers who are in those models.
Mm-mm.
Sometimes, you know, that's what you have. That's your,
Sure.
you know, you don't have the interest or the ability to kind of do anything differently.
Yeah.
And so you're kind of in that box, and you do the best you can
Mhm.
within that box, you know, with the tools that you're given.
Mhm.
And so it's, you know, it's unfortunate, but it's sometimes the nature of the beast.
It's reality.
It's
Yeah.
the reality.
Yeah. So, so this show is primarily midlife. It has been primarily women, but it didn't have to be. So when you were willing to be on there, I was like, oh, I'm excited. This is going to be my first male guest. I'm excited. So, but in your practice, do you primarily see women? Is it women that you primarily see for this kind of hormone, multidisciplinary kind of model, or is it both equal?
It's both. It's pretty equal.
Yeah.
You know, you have to remember that majority of women that I'm seeing, you know, have a spouse
Yeah.
as well,
Sure.
and typically in the similar age bracket.
Yeah.
And so very frequently I see one, and then the other one closely follows behind.
Yeah.
So it's, you know, it's kind of like you fix one, you get them feeling great, and then the other one's kind of lagging, and then they drag them in. And it goes both ways, both male and female.
Sure.
I do have a large, you know, hormone population for men as well, TRT, that I take care of, and a lot of times that'll end up, hey, I really, you know, my wife's been struggling. You know, do you see women as well? It's kind of the conversation. Or the same thing, I'm talking with a woman who gets referred by her girlfriend, and then, hey, you know, these things you're saying, like, really, I think my husband's maybe could use some help. And
Yeah.
So both sides of the fence, for sure, both male, female.
So can you describe your typical patient that seeks your help, like your first conversation that you have with them?
Well, on the female side of the world, a lot of times they're coming in struggling. By the time you come see me, so I own a med spa, right? It's a functional medicine clinic, but it's a med spa. I'm not your typical first go, right? And I respect that. I don't expect to be the first go. It's rare that I am. And so by the time they see me, they've seen their primary care, they've seen their OBGYN, they've not gotten the answers that they want, or they've been told that they just have anxiety, or it's just depression, or it's whatever, and they get put on meds that they don't want to be on, and they're like, no, this is something different. And a lot of times they're frustrated, and so they come to me and they're just, I don't know what's wrong with me. Something is wrong with me. Everybody tells me I'm normal. I don't feel normal. You fixed my girlfriend. Can you fix me? Like, it's that. A lot of times that's probably my typical patient that comes through. And the reality of it is what they're feeling typically is like this perimenopause is what's the thing that's mostly disturbing. Most women know what menopause is.
Yeah.
It's like they understand that.
Yeah.
They understand hot flashes. They understand not having a period. Like, they get that. The 10 years prior to that, most women don't understand. And it's getting talked about more, and people are having this conversation
Yeah.
more, and people within the medical community are talking about it a little bit more. So it's catching some waves here. It's moving. However, women in general kind of understand it, kind of don't understand
Sure.
it. And so when they come in, they're in this kind of chaotic situation hormonally, which affects them in so many different ways, and it's just very difficult to understand or appreciate. And a lot of times, they're complaining about, like, I don't know what's going on. I just don't feel right. It's very generalized. Or they're like, I don't know. I'm just always upset. I'm just always irritable. I'm snapping at the kids. I'm snapping at my husband. I'm just like, and it's not me. I don't feel like myself. Or I'm anxious, but I'm not anxious. Like, I'm not anxious because, like, life is good. Like, my life is fine. Like, and then I'm kind of down. I'm feeling like, dare I say, depressed, but I don't know. I just don't have any motivation. I don't want to do anything. Like, I'm just, no energy. So a lot of times they'll talk about lack of fatigue or energy, and then that lack of fatigue and energy gets kind of looked at as being like depressed, or I'm depressive because I'm not wanting to get out and do things. When the reality of it is they're not really depressed.
Yeah.
Clinically, they may feel as if, or you could technically probably diagnose them clinically, which is what happens a lot of times.
Yeah.
But it's not true depression, right? It's not true anxiety. A lot of times women will talk about, having more panic attacks, having more kind of just anxiety that starts from the inside, which they're like, I've had anxiety before in the past, like situational anxiety, like things like that. This is totally different. This is like something I can't control, where they'll have palpitations and increased palpitations at night.
That threw me for a loop when the palpitations started.
Yeah.
I didn't know what the heck was going on.
And a lot of times it's at night, or it's when you're in stressful situations. A lot of the hot flash side of the world does come like with stress. So people they'll be going to a meeting or something, and they're like, all of a sudden the hot flashes kind of kick in, and it's kind of starts with palpitations, and it starts in the inside, and it just kind of comes out, and they're like, I don't know what is happening to me, like, so there's this kind of generic, interesting thing that occurs through this chaotic time period. The other side, a lot of times women will come to me, because I do weight loss as well. So a lot of times women will come to me with this abnormal weight gain. It's just not like, I'm gaining weight, but I'm not changing my diet. I eat great. I count my macros. I do all this sorts of stuff, whatever it may be. I work out. My workout's not changed. I'm still doing all these things, but I'm gaining weight. Like, I can feel the difference. And so what we see is this change in body composition with women and perimenopause, where you tend to have a lot more of abdominal fat and visceral fat that tends to accumulate. So there's this weird, weight gain, body composition change a lot of times that women get frustrated with.
Yep.
And so they'll come and see me, to talk about, weight loss medications and all this sorts of stuff. And I'm like, let's talk about your hormones.
Yeah.
And I kind of throw them off a little bit sometimes. So there's a whole nother laundry list of things, but those are the big ones. Insomnia is another one.
Yes.
The frequently waking up at night. That's a big one.
Yes.
And a lot of times these I have to pull out. So a lot of times.
Well, because we don't know that's a symptom, right? Like, so for me, it's I can go to sleep, but I wake up at 3, and it's maybe I can get back to sleep, right? So once my mind starts to race, the anxiety piece or panic piece starts to like, I can't shut it off. So, but I didn't necessarily know that was a symptom until people start having. I was like, oh, yep.
There's normally kind of a list that I go through, with women.
Yeah.
I'll ask very specific questions, and they're like, "Oh, yeah, okay, yeah, is that related?" I'm like, yeah, it is. Like, oh, I thought, like, I went and saw a cardiologist because I was having palpitations and stuff, and I'm like, and everything turned out fine, right? And they're like, yeah, that's the story majority of the times. People will get diagnosed with like panic disorder and stuff, especially if the palpitations were bad enough where they like went to the ER or something like that.
Yeah.
A lot of times they get kind of misdiagnosed.
Yeah.
So, but yeah, the waking up at night, a lot of times it's a vasomotor thing. It's an estrogen thing. And so the same mechanism when it comes to night sweats and hot flashes, And night sweats is another one. And kind of these intermittent night sweats that wake you up. If they get bad enough, like the late stage perimenopause, I mean, it's like 2-3 times a night. I'll have women, they're changing, I had a woman the other day. She's been able to wear her pajamas now more than once. I was like, that is a very good marker. It's like, I'll wear my pajamas multiple times, during the week back in the, I used to. She was like, you only wear them, whatever. And I was like, okay, I'm just trying to figure out where this is going. And she's like, yeah, I'm like, I've had to change my pajamas every night, and now, I'm able to wear them multiple times because I'm not sweating through them.
It's the little things. You got to take those wins.
I was like, I hear, women talk about, just being generally a hot nature.
Yeah.
Like, I'm just hot natured. Like,
all the time.
Yeah. And that's another
all the time
little thing. So a lot of times it's a myriad of symptoms. And if somebody comes to me with just kind of one symptom, just one issue, I'm a little more hesitant. I'm a little more like, let's maybe dive a little deeper into that.
Yeah, sure.
When they come to me with a bunch of mild symptoms, where it's like a little bit of this and a little bit of that all over the place, that rings a little bit more true to, okay, we probably got some little hormonal things going on here.
Yeah.
So yeah.
So what treatment approaches do you typically use? Like, what's your methodical?
Well, from a treatment standpoint, there's a lot of ways to skin that cat.
Yeah.
Every way has kind of different risks and benefits and different approaches. So for me, I would say a vast majority are going to be on some sort of patch or injectable or pellet therapy.
Okay.
Those are kind of my two that we end up going down. Now, there's other methods out there, pills, right? Everybody knows about taking hormone pills, but that comes with some risks. And so I have that discussion. So I typically tell women I'm not a huge fan of the oral pill side of the world for this, for the menopause treatment of hormone therapy. And I'll give them all the risks and benefits and all those sorts of things. And I've got a few women who do choose the pill side of the world for one reason or another. And then the topicals, there's creams and gels and all of that, and as well as intravaginal creams, and suppositories and things like that. Those come with their own, like I said, risks and benefits. A lot of the risk side with those are more just the daily application or the regular application of the medication that kind of annoys people that they're not interested in. Absorption, I'm always talking about, is it going to, are we going to be able to control it? Are you going to get the benefits from it?
Sure.
Is it going to absorb enough or not? There's some argument there, so we always have that conversation. I've got a few women, not a ton, but a few. Again, a vast majority of women, like an estrogen patch or like a testosterone injectable, kind of combination depending on where they're at in their perimenopause too. When we get more the kind of the late stage perimenopause where we're like knocking on menopause door, that woman, a lot of times the pellet side of the world is better, and also depending on lifestyle. And so, the pellet procedure is a procedure, right? And so, once every 3 months or so. So that procedure itself may not be conducive to somebody's lifestyle and what they want, or they could just be completely scared of having a procedure done and they're just not interested.
Sure.
Or vice versa, they have a reaction to the patch, or they don't do good with adhesives, or they, the injectables. So there's all sorts of little things to consider with the therapy, whatever therapy it is. And so, generally speaking, I go through all of this and all these therapies with a woman, and just kind of we discuss, what they feel like would be their best option.
Sure.
Right? And my role, I always look at my role as an educator. It's like, I'm just going to educate you, and ultimately you're going to make the decision.
Yeah, because it's your body, right?
We're partners in this.
Yeah.
I may have information you don't.
Yeah.
I can explain certain things maybe that you may not fully understand.
Yeah.
And so it's my job to educate so that you can make an educated, informed consent, on, what's going on, decide what's best for you.
Yeah. Knocking on the door of menopause. I like that. So because I do the pellet injections, which is what, so I didn't realize it was because you thought I was coming knocking on the door menopause. It makes sense, whatever. Because I absolutely am. I'm turning 50 this year. So, but no, but that's interesting. That's, yeah, I mean, you as a problem solver, right? Like you have to look at the whole person.
Yeah, it's
Yeah.
it's the whole person, and not only that, they have you have preferences, right? You have what you want to do, what
Sure.
you don't want to do.
Yeah.
And
Every 3 months is very optimal for me. I like that a lot.
there's something to be said about the the set it and forget it
Yeah.
mentality.
Sure. Yeah.
And a lot of women like that. They're like, look, once every 3 months, that's it, done. Very little downtime. So
Hardly any downtime.
Yeah.
Yeah. And like, so not to get too personal, but the way that he does it, it only takes me out of the gym like a couple days.
Mhm,
Like it's
mhm.
incredible.
Yeah.
And I feel great. It's like not a big deal at all.
Yeah.
Yeah. Never have any problems. Never have any the injection site heals up really. You're very good at it.
Yeah, try.
You're very good at it.
There's a high percentage, where that's the case. There's always instances,
Yeah, but you can have that with anything.
You can have with anything.
Yeah.
If I do the procedure on you 10 times, I typically say within 10 times, there's going to be one time that's not as pleasant as the other for whatever reason,
Sure.
whether it be bruising or tenderness or, doesn't quite go as well as the other 9 did.
Mhm.
It's kind of a roll of the dice. It's a new procedure every time.
Yeah.
So
Yeah. Yeah.
each procedure could have somewhat of a different outcome.
Yeah. So you're treating, you're constantly like looking at you. For me, it's like labs every 6 weeks, and then it's like different. Anyway,
Yeah.
so you're constantly looking, assessing things like that. So what are some common outcomes that you see typically as you're treating, as you continually see your patients, and then like time frame? What do you usually tell people, like by this time you should be feeling better or whatever?
Yeah, so really depends where you're at.
Okay.
If you're early perimenopause versus say late
Yeah.
stage perimenopause, or and then like kind of full blown menopause.
Sure.
Right. Your symptoms tend to be different.
Yeah.
Right. 1. 2, it depends on what your symptoms are in general. Right. So if you're early to mid kind of perimenopause, and all we're really dealing with is maybe a little bit of fatigue, a little bit of insomnia, and some weight gain, your perception on results on what you're going to feel is going to be completely different compared to, say, a menopausal woman who is completely estrogen deficient, who is having horrible hot flashes multiple times a day. Like, they're going to see that change quickly.
Sure.
Right?
Okay.
So they're going to see a significant improvement in a very short period of time. The further or the closer you are to menopause, tend to have more significant symptoms.
Okay.
So you tend to see a benefit quicker.
Okay.
Right? So with that woman who's like late stage menopause and into menopause, or late stage peri and into menopause, I normally tell them a week to heal, and then a week for the numbers to kind of work their way up, so you start feeling some form of benefit.
Right.
Like you said, I get labs about 5 weeks or so, and you're normally following up with me about week 6. At that point, we should have something, right? There should be some sort of benefit, something that you can recognize. Even if I have to like pull it out of you, even if it's not something you're like, oh yeah, that's right, I have been sleeping through the night, or I do wake up a little bit more rested,
Yeah.
or I'm not having that 3 p.m. crash, or whatever. There's a lot of times there's something there, and that's what I would expect. I'd expect something within that first window. Now, there's plenty of times that I've had women the whole first few months, there's not much there. That tends to be kind of like my early perimenopause.
Okay.
Like there's not enough of a deficiency there where they're noticing a significant improvement in whatever it may be. It also depends on the therapy too. So if we're dealing primarily with estrogen, a lot of times you'll see, a significant improvement in symptoms, because those symptoms tend to be a little bit more significant,
Sure.
a little more severe. Where if we're dealing primarily with testosterone on the testosterone side of the world, you're not going to necessarily see a drastic change per se. Now, caveat to that is if I have somebody who's super athletic, working out on a regular basis, super active, they are probably going to see some improvements in their workouts and their activity and the physique side of the world. that you gain from, joint pains and issues, things like that you get from testosterone specifically. So they may see that portion of it a little earlier, increase in libido, those things.
Yeah.
But it's so just my point, I guess, is through the spectrum that is perimenopause, menopause, postmenopause, right? Through this 15, 20-year period of time, and perimenopause itself is 7 to 10 years, right, upwards of 10 years, and then the 5 years to 10 years after menopause. That period of time, there are a lot of different like roller coasters that you're on, right? And so depending on where you're at in that ride will depend on what we're ultimately seeing from symptom improvement.
Yeah, I mean, and talking about roller coasters, so it's not just the physical health, right? So like midlife, I feel like is you're thrown into the roller coaster of life, of like aging parents, launching kids. So you have all that piece too with the physical piece, right? So yeah, no, that's smart.
And I always say like, women are way stronger than men. Men break down so quickly. Women kind of hold everything together. And what happens during this period of time in life is you end up having a lot of reasons, a lot of excuses, a lot of answers to yourself of why you feel the way you feel. So it's aging parents that you're taking care of, right? You're in the prime of your career typically. Like this is like your money-making years where you're doing a lot. So it's and then your relationship, right? This is the point in time where both men and women in their 40s typically, right? It's mid 40s upwards through up to 50. Where both your hormones are on this roller coaster. Men's hormones are likely on a decline. So relationship-wise, we're both hormonal. And so there's always something, there too. Kids, right? Wherever you're at in that stage. So you're having to take care of, kids getting older or even young kids, aging parents, your own relationship, plus your work-life balance. It's a lot. And so it's very easy to go, oh, this is why I'm not sleeping well. Oh, this is why I'm tired and fatigued and I'm depressed. And this is, I'm gaining weight because, of all these other, so there's all these other like reasons. And so sometimes it's very difficult to turn around and go, oh, maybe it's something that's out of my control. And maybe this is something that is not innately exterior, but more interior. So.
No, I mean, and I've said this 1,000 times, the main reason why I started this podcast was birthed out of my own struggle of midlife. It blew my mind. Everything just kind of blew up all at once, and no one was talking about it, and I felt completely ill-equipped, and everything was changing and whatever. So, so this podcast for me has been so beneficial to learn and glean from people, from other people's experiences and professionals too, of like, what the heck's normal? Like, what's normal, what's not normal, and when do you need to seek help, right? Like, it's been super beneficial for just me personally to have those conversations. People don't talk about it, and there's an element of like embarrassment, I guess, or like just keeping it in. I don't really understand lack of vulnerability or lack of desire to be vulnerable with these kind of hard.
And I feel like that's changing.
I
feel like that's opening up. That's been there through the years, especially with men too.
Sure.
Heaven forbid you talk that about low T. I mean, then all of a sudden, you have erectile dysfunction. So there's a stigma that's associated, with things that's just a lot of times there's not a direct correlation. And with women, sometimes it's hard to have that discussion of I'm coming towards that stage in my life, right? It's almost like the end of womanhood. Like and there's this weird stigma that's on it that I obviously I'm a guy. I don't personally understand, but I could get where there's been in years past this kind of interesting conversation where there's a negative connotation with menopause. Or there's the kind of the old school, approach of, well, it's just part of welcome to being a woman. That mentality too, and which most women are like if I don't have to feel like this, like let's not.
That 100%.
So there is a weird stigma, but I really feel like that's changing. More women are talking about it, and I think a lot of it has to do with social media, podcasts. And then just us as a society becoming a little bit more vulnerable and willing to have the conversation. I have more men and buddies. I mean, just this weekend, I had a buddy of mine like, hey, I need to swing by and talk to you. That would not have happened,
Sure.
10 years ago.
Yeah.
And now like, hey, I want to come by and chat with you. Friends of mine, girlfriends of mine, right? The friends of my wives.
Yeah.
That are friends of my wife, not
I got it.
plural wives, to be clear. But where they're reaching out, going, hey, I wanted to see if I can talk to you professionally. Like, can I make an appointment? Like, how does this work? And I don't think that conversation would have been had, 10 years ago.
Yeah.
And so I really do feel like just in a short period of time that there's more discussion.
Yeah.
So.
No, it's good. So that's actually a good segue. We talked about the physical piece, right?
Mm-hmm.
But the emotional and like psychological component is just so important.
Yeah.
It's a huge piece of it that you can't just ignore. So what would you say are the most common like emotional, psychological complaints that women have when they come in here?
It's irritability.
Okay.
Is probably is up there, but then most women will describe it very generally. They're like, I just don't feel myself, right? And a lot of times I'll bring that back to it's a psychosocial thing going on. It's an estrogen roller coaster that they're on, and so they'll have periods of time where they have really low estrogen, and then a short period of time where they have really high estrogen surges, and so there's this, roller coaster a lot of times. Or I've had women where they just they still kind of a normal ovulation style, but it's just very low, so they just have a baseline of low estrogen. Well, estrogen's your lovey-dovey, your feel-good. Estrogen is kind of what kind of stabilizes you a lot of times on the mental aspect of the world. And so, this is the whole, a lot of times I'll tell you, this is the whole idea of being hormonal, right? When your estrogen's really high versus estrogen really low, but being, grumpy versus really kind of emotional, crying at random things, whatever. Right? So estrogen's powerful in that sense. And a lot of times it's the irritability, the just general feeling of being down, like depressed but not depressed, the snappiness. I always talk about the
irrational rage. That's what I've called it.
Yeah, that's a
irrational rage.
Like,
and it hits you like that.
The example I always use, like your husband, folded the towels wrong, and it's like, I know it's not that big of a deal, but you folded the towels wrong. Like the large bin's supposed to be facing out, and these lines don't match up.
How could you not know that?
I've told you 5 times. Like, why? So it's and then you get into a knockdown, drag out fight over a folded towel, and then the next day you're like, I apologize. I really don't know why the folded towel set me off, but.
No, and so it filters down to the kids too. That irrational rage that gets snapped with when you have an interaction with a child, a teenager, typically teenager at this point when you're, which I don't know what the heck God was thinking that perimenopause and raising teenagers would be at the same time, but whatever, that's another thing. So then you're like damaging that relationship with your kids if you're not careful. Especially if you don't go back and apologize, right? Like you have to go back and recognize like that was irrational. I'm sorry, like, like that kind of thing. But so a relationship piece is such an important part that I don't know if we really recognize. And so this is what I find fascinating with this. So like divorce rates. So there's a spike within the first couple years of marriage. There's a spike within like year 7. And then the next spike is when you launch it's like around now, like when the kids are teenagers or when you're in midlife. So then in my mind, I'm like, I wonder if we could get this all under control, if divorce rate would go woo, like way down.
The amount of marriages I take credit for saving.
but really.
Like, I don't take the credit. They give me the credit. It's I always say if I could see a husband and wife and like get the ball rolling around 45, I'd probably save that divorce by 50 mentality.
I would put money on it.
It's crazy how much stress gets put into the relationship, right? Because you have these irrational things
Yeah.
going on, on top of, as as hormones drop, both men and women,
Yeah.
libido goes down. So, sex is not there. It's kind of like the idea of a sexless marriage type mentality. You're like roommates. Well, by the time you're 50, you now have 5, 6 years, 7 years, 10 years maybe of this kind of a relationship.
Mm-hmm.
Now the kids left the house and you're stuck with each other, and you're like,
I don't know you.
Who are you?
Yep.
Like what?
Yes.
Like I'm ready to go do something else.
Yes.
And so yeah, so it's an interesting concept and thought process. Clinical practice, 1,000% it's real. I see it all the time.
Yeah, because it's multifaceted, right? Like you said, just take one piece of it. Your libido changes. Like if low T or like whatever, like that changes. It's not just the sex piece; it's the intimacy piece too, right? So you're not connecting at all.
Well, you're not. What you'll find a lot of times is then, especially on the male side of the world too, is they're not as, when you have really low testosterone, you're not as lovey-dovey. Your estrogen goes down as well, so you're not wanting to emotionally connect either. And so you have the woman who's kind of disconnected, feeling down, all this, and then the man in that same boat. It's a recipe for
And
disaster.
women want to be pursued. Men aren't pursuing when they feel like that, right? So so then they feel abandoned, and like it's the whole thing. It has been a fascinating like progression in my mind of, wow, I bet I would put money on the fact of how many marriages could be saved and flourishing if we were to address this piece at this time.
And it's and it typically, like I said, it's like mid-40s.
Yeah.
And even then, I say mid-40s. I have a lot of patients like late 30s, early 40s. I mean, perimenopause. I mean, I would say on average around 40 is when majority women. But so if I get a woman who comes in here and she's 36, 37, 38. I'm not surprised.
Yeah.
I'm not like pushing her away, going absolutely not.
Right.
Like let's hash this out, make sure we're not missing anything. But I'm not surprised. I mean, menopause is anywhere between 45 and 55 for the most part on average.
Yeah.
So she could be one of those ones who's going into menopause
early.
At 45. So I tend to ask, when did your mother go into menopause? And that's a pretty good indicator, plus or minus a couple of years. And so if we can gain that information, then it makes more sense. It's like, oh yeah, you're definitely in that window. So,
sure. Yeah. No, that's great. I think it's fascinating. I think it would be a fascinating study. Like a longevity study of people, like couples who have, or just one of the spouses, if it has reduced divorce.
I could attest.
Just clinic. Yeah, totally.
It's, again, them coming back to me and saying, "Oh my God, you saved our marriage."
Yeah,
like this is insane.
Yeah, that's awesome, and that's like cool for. I mean, that should be so encouraging and cool for you, just as a practitioner of like, wow, I don't just make them feel better, but like
life changing.
Yeah,
life changing. It's that's why I got into this side of the world.
Yeah.
That's why I did this, was because I got just fed up with sick care. I got fed up with putting a Band-Aid on, running people through the machine, and insurance companies telling me what I can and can't do. Just all of that. It just was like, I'm not helping anybody. Like I'm really not helping. Like let's gotta do something different. And then the hormone side of the world was just kind of fell into my lap in a way, helping friends of mine, buddies of mine, stuff like that. And then I was like noticing the reward that I got personally, like my personal reward.
Yeah.
And I was like, it's a mixture of like, hey, I'm actually helping people, but then selfishly I'm helping myself.
No, 100%. And how could that not spur you on, like just personally and professionally, of like, this is where I'm supposed to be. This is what I'm supposed to be doing. I'm excited about what I'm doing. Like.
Well, there was this black hole of people, right?
Yeah.
Like are not getting treated.
Yeah.
And are not getting the attention that they need.
Yeah.
Right. So there's this lack, this gap in care that has occurred, due to the model. And so I was like, well, if I'm stepping away from the model, I can fill this gap. And not only can I fill this gap, so there's a patient population that needs help,
Yeah.
that's interested in it, that wants it, and then turn around and also fulfill myself. Like, why not? Let's go.
That's cool. So relationship piece, just in a spousal relationship, in a kid relationship, mother, kid, whatever, like that's a huge benefit outcome from going under treatment. So what do you think are some other primarily like emotional, psychosocial benefits that you have seen?
Better feeling of self-worth.
Okay.
Like looking inward.
Yeah.
Like you feel more like yourself. So you feel, again, it's more of like it's a self-worth motivating type mentality. So a lot of times women will have this increase in motivation, they're not feeling as down, they're more up, they feel more like themselves. And so it kind of snowballs. The example I always use is if you're, tired and hungry and haven't slept in 24 hours, you're not exactly the nicest person to be around.
No.
And you're not,
Hangry is a word for a reason.
Yeah. And so it affects you emotionally, right?
Sure.
It affects you and your surroundings, you and everybody else, But if you're, upbeat, well rested, you've got, you're positive, right? And your mentality is positive, then it affects everybody around you, affects your whole situation. So you tend to make better choices. You tend to make better choices from a diet standpoint. You tend to make better choices lifestyle wise. And then you're motivated to go do things with friends and family. And like you get home and it's not like, straight to the couch.
Right.
You get home and you're like, okay, what are we doing? So, or on the weekends, you want to get on. So it's kind of this snowball effect where it affects everybody and everything around you in your life. And it tends to affect it more on a positive nature.
I mean, how could it not? If you feel better, then it's just going to filter into everything else.
Correct. Yeah.
Yeah.
Grumpy people tend to not do well. And happy people tend to do better.
And it's a spiral, man. You're grumpy, so you snap, so you push your friends, family away, which makes you grumpier and lonelier, right? So it's just that downward spiral.
Correct.
And somewhere we just need to stop it, right?
Yeah. Absolutely.
Yeah. One question, because do you ever supplement or treat progesterone? Because you've only talked about
estrogen and testosterone.
Yeah.
Progesterone's important, man. Estrogen's super important, both men and women. Testosterone is important, but it definitely has a role with both men and women.
Sure.
For sure. But it's probably not near as with women. It's not near as important as estrogen and progesterone. Progesterone plays a key role, and there's a couple different utilizations of it. It depends really on what's going on with the patient themselves. So,
okay.
Some big key factors with progesterone. So, general rule of thumb, progesterone protects the uterus essentially whenever you are giving somebody estrogen. So if you're in menopause, you're not shedding the uterine lining, right? You're not having a menses, not having a period. And I give you estrogen, then I'm going to give you progesterone to kind of offset that, right?
Okay.
To help protect the uterine lining, to help keep you from developing what's called uterine hyperplasia.
Okay.
So thickening up essentially. This also helps protect you from developing uterine cancer.
Okay.
Right. So that's the mentality.
Okay.
That's where it comes from. So progesterone is super important, but progesterone also can help in regards to perimenopause too, depending if we're still having bleeding issues, irregular bleeding issues. If somebody doesn't have, nowadays we have IUDs and that stop, like the Mirena, as well as ablations. People get uterine ablations and those sorts of things. And so you can use progesterone to also help with bleeding issues, with hormone therapy, those sorts of things. So, in a bunch of different ways, whether it be like a norethindrone, like we call progesterone mini pill, or the 100 milligram, 200 milligram straight progesterone that we typically use for somebody who's in menopause. But it can be used in some very specific cases. Sometimes I'll use it on women who are kind of that late stage perimenopause, who are having some changes in their cycle, and they're having these really big estrogen spikes. spikes and things, we'll use it to kind of settle that down and to maybe regulate their cycle a little bit better. So yeah, just very much individualized, but very important.
Yeah. Well, thank you so much, Travis, for being willing to talk to me and so much information. I highly recommend you take your symptoms seriously. And if appropriate, seek out help, because you don't have to feel crappy. Right?
I agree.
Right? You're not crazy. You're not crazy, and you don't have to feel badly.
You're not crazy.
You're not crazy. If I say nothing else, you're not crazy. But thank you. I appreciate it.
I appreciate you. Thank you for having me.
Yeah, of course.